I'm Monica Anz-Cavazos. I'm the internal medicine doctor for the Texas Center for Medical and Surgical Weight Loss. And I run the pre-op and post-op clinics for our bariatric surgery patients. And I also run the non-surgical weight loss clinic for patients who are not candidates for surgery. A lot of our patients prior to surgery need to lose some weight, and that can be because their insurance company is requiring them to undergo a non-surgical program prior to them covering the surgery, or it can be because the surgeon feels like the patient would be a better candidate for surgery if they lost some weight prior to. So I run a non-surgical weight loss clinic, and we focus on exercise, we focus on diet, nutrition, and behavioral issues as well. And we also look at other medical, we call them comorbidities, other medical problems that are related to obesity that the patients may have. And we use that time as an opportunity to get those medical conditions under control prior to surgery. Some patients have diabetes, high blood pressure, sleep apnea, all kinds of medical problems that may or may not be well managed, and especially in the patients who may not have a primary care physician, who need help getting those things sometimes diagnosed and under control prior to surgery. So we do that also. And that's preoperatively. We also assist in the preoperative process in educating the patients in terms of what they are going to be expecting, what they're going to need to be doing differently after surgery. And then on the post-op side, there are a lot of changes in the patients, and not just their weight, but their other medical conditions change sometimes very dramatically after surgery, and so we help monitor those things. We monitor vitamin levels, we make sure they're following their diet, and we have a kind of a set program for follow-up. We see patients in 1 week right after surgery. The surgeons will see the patients and check on them and make sure everything's going okay right after surgery. And then the medical team, which I lead, sees the patients at 1 month, 2 months, 3 months, 6 months, sometimes 9 months, and 12 months after surgery, and then every year after that. So we continually go through these things, and we check and make sure, especially vitamins, supplements, are you taking those? Again, making sure they're doing their exercise routine, following the rules of bariatric surgery, see how they're doing emotionally and how they're handling the changes that they've undergone. And we also do lab work at set times throughout all of this. So that's what I'm in charge of.
Why is that important, the pre and the post-op care that you provide?
Well, bariatric surgery is not just a solitary event. The process of actually going into the operating room and having the surgery done is probably only 50% of the whole process. The changes that you undergo extend far beyond the anatomy of your stomach, and it certainly has its effects on a lot of other systems and organs and the emotions as well. So the full program is really critical, I think, to having a successful surgery. You need to be in the best shape you can be before surgery. We try to get, we do labs and we do all kinds of other things to make sure that everything is lined up, that we've got everything in the best condition it can be in before surgery, again, to help ensure the safest and most successful surgery. And then after surgery, the amount of care you have to take in choosing your foods and choosing your activities, your lifestyle, handling situations that are going to be tempting for you to go back into your old lifestyle. All those things need to be very carefully and consistently dealt with. And monitoring, the other medical issues. People with diabetes and change, dramatically after surgery, and people with high blood pressure and people with, heart issues and all of these things, sleep apnea, they change dramatically and improve after surgery, and you need to be watching for those things. You need to be following lab work and checking those things. A lot of these patients have primary care physicians who are familiar with the close monitoring that's necessary as these patients get off of their medications. But some are not, and so some, appreciate the help in terms of, what do we need to be monitoring, what do we need to be checking for. And there are certain vitamin levels that can get low after surgery, and so they need to be monitored. You need to make sure the patients are taking the right vitamins and then also checking the blood values to make sure that they are absorbing as much as they need. And so knowing which ones to check and when and how often is important. And having a program that incorporates all of these things, which we do, I think is critical to having a successful surgery.